Yes, wonderful people, welcome to your Saturday lovely show. That program where they talk about health and everything we get to do with Health Matta. As our people they talk, they say person wey get good health, he get everything. And it ba lálàáfíà. Ohun gbogbo ló ní, that is to say health.
Benny.
Doctor is speaking.
Doctor, do you know? No, but without Benny, that one as Sakamanje. I want make even use Hausa Greek people today. Make them know say it's nationwide. Use Hausa Greek people. Make them know say it's nationwide.
Sanonko mutane mu mutanen arewa. Won't get cheku.
What did you say?
I greet you all.
Okay.
Oh yeah, use Igbo greet everybody.
And the buy ekenemo.
Hey!
Everything is done.
Use Yoruba. You have to complete.
So don't ever say Yoruba.
Yeah, Yoruba.
Say Ekaro. Just say
Ekaro. Thank you very much.
That's good. That's so good.
Thank you.
CEO Grace Valley and the medical director is always here to enlighten us on things that has to do with health. Dr. Bat?
Yeah, thank you very much. Good morning, viewers at home and around the world. Once again, we are back to Health Matta on WAP TV. My names are Dr. Bartholomew Tochukwu Febuna. I'm the medical director of Grace Valley Medical Center. This morning, we'll be revisiting a topic we started some few weeks ago. Erectile dysfunction, otherwise known as impotence. Or ED for short. Okay, now, we'll be dwelling more on treatment of this condition because a lot of callers that called even outside the program, okay, they had a number of observations that we don't dwell much on the treatment of the condition. So this morning, hopefully, we're going to do justice to the treatment of this condition. But I must also beg of you, in trying to do justice, we may not do it the way you want, in that we won't be mentioning names of drugs, brand name of drugs. Okay, so we may, because we have to play by the rules. Okay, so let's just quickly give a recap of what it's all about and then run down some of the things we have spoken about or discussed before we go into diagnosis and treatment. And of course, we'll conclude today with prevention. Okay, so erectile dysfunction. Okay, first, let's talk about what we already know about, talking about the anatomy of erection. Okay, now, as a man, every adult man or a normal man should have a penis with two testes or testicles, if you like. Okay, now, when you talk about the anatomy of erection, we are concerned about the penile shaft. And like we said before, this penile shaft has three distinct structures. Two of them are on either side. They're the same thing. One at the middle. Now, the one on either side is called cavernosa tissue or corpora cavernosa because there are two in number. The one that is on the middle is called corpus spongiosum. Usually, it transmits the urethra, which is the tube that conducts urine from the bladder to the exterior and also conducts semen in occasions of sexual intercourse to the exterior as well. Now, these tissues are made up of spongy-like tissue in the sense that they have the capacity to swell up, okay, when there is an increased blood flow into the tissue, they expand and as well as elongate in the process. And that of course, brings about erection. Now, these tissues, too, are covered by a thin fibrous tissue, so more or less like a compartment, okay? Now, this thin fibrous tissue is called tunica albuginea. Usually, it's elastic, but also a bit non-yielding, in the sense that the stiffness, when there's an increased blood flow, helps to keep the penis erected. Now, what happens is that usually for a man, suffice to say that sometimes erection can actually occur without having anything to do with stimulation, okay? that is normal. We find it normal. It can occur in children. It can occur in adults, okay, when it has nothing to do with sexual stimulation. But if it has to do with sexual stimulation, it involves a complex mechanism that usually will involve the neural factors or components, if you like, the vascular component, the endocrine component, as well as other processes that are involved. For instance, when a man is stimulated sexually by way of having an erotic thoughts, or it could be a visual picture and all that, what will happen is that there will be messages that will be sent across to the brain via the nerves, the messages, the interplays that will take place. Now, this will bring about a release of nitric oxide, which is a form of vasodilator. Now, this nitric oxide brings about relaxation of the smooth muscles of the penis, as well as the blood vessels, and then there will be inrush of blood, increased blood supply, flow to that region of the body. And of course, as this is happening simultaneously, venous return is impeded or is blocked. Okay, so that will bring about erection, stiffness, turgidity of the penile shaft. That is what happens. Now, suffice to also say that challenges or problems of erectile dysfunction will have to do with anything that adversely affects all of these components. For instance, anything that can compromise the vascular factors, okay, in form of diseases, which of course, under which you have cardiovascular diseases, okay, like hypertension, cholesterol-related problems that we refer to as dyslipidemia, okay, atherosclerosis as well, okay. This can bring about a reduction in blood flow to the penis. And when this happens, it affects erection and can cause erectile dysfunction. Also, problems that will affect the nerves that are contained in this penile shaft, the pudendal nerves and all of that, okay, that can equally bring about erectile dysfunction. Challenges that can affect the nerves include things like diabetes. Diabetes not only will affect the nerves, it can equally cause reduction in blood flow to the penis. Apart from diabetes, you also have some other disease entities like epilepsy, Parkinson's disease, polio, multiple sclerosis too. All of these can affect the nerves and can bring about a damage to the nerves and can cause erectile dysfunction. Apart from some of these ones, cancers too can cause that, as well as treatment for cancers, okay? Some invasive procedures, medical invasive procedures that have to do with the spinal cord, okay, can actually bring about some of these challenges, but usually on temporary basis. I must point that out, okay? Also, pressure symptoms too that can occur as a result of frequent riding of bicycle for a prolonged period of time can actually bring about a compromise in the innervation of the penis, and that on its own can cause erectile dysfunction. Endocrine-related problems too, when you have reduced hormone, testosterone now, because we are talking about males in the body, okay, that can cause erectile dysfunction. Also, it has to do with aging, in the sense that as we age along as men, the problem could show up, okay? Now, but some of the things that could bring about erectile dysfunction with age is not just the fact that the person is adding up in terms of number of years, but the fact that as we age along, we carry a number of baggages that were not there during our much younger ages, okay? Like someone who along the line picks up hypertension, who along the line picks up diabetes, who along the line picks up cholesterol-related problems. All of these can help to add it up. So age is a risk factor, but that is not to say that people who are old cannot perform creditably well.
But doctor, you know, say you get one very funny one, and I sure say Chief said go attest to that. They'll talk say putting phones in your pocket, that I don't know, that is really not good. That it affects
semen or something.
Yes, it's a question we've entertained a couple of times in this forum. Uh, Actually, it will affect more of, it will cause more of infertility, okay, in the sense that it will damage the process of spermiogenesis. You know, newer studies are coming out trying to catch up with technological advancement that we have in the society today. Okay, so that can cause more of infertility. Okay, so
okay, maybe I should quickly take my own stroke of the thing that I have here, sir, is there's a particular question that says seeing a slight semen on the penny while defecating. Some people feel maybe if they absent from sex for a long time and it happens is a normal thing. Some are of the school of thought that no, whenever you see a semen on your penile structure, it's a sign of disease. What is the medical stand for this? Is it every time a man sees any slight or any slight semen on the penis, does that signify diseases, or it could be maybe over secretion of
Thank you very much for that question. It's a funny one too, but sometimes it's natural in that of some of the times we have experienced it ourselves. So it's not like talking about something that is strange, okay? But I have this to say that when one sees semen, maybe you wake up and you discover that you have a stain, maybe your boxers or whatever, okay, it doesn't mean a sign of disease. It doesn't mean there's a problem. Okay, so neither does it mean that there's over secretion or the overfilling of the system, if you like. I don't want to use the word overload.
Overload. I think that's the appropriate word now.
Okay, but there's no such thing like that. Okay, nature is just trying to readjust to itself.
But why defecating?
Yes, why defecating? Because you're exerting pressure. You're exerting pressure. Permit me to also point out sometimes as men, we do have wet dreams. At the middle of the night, you just, even when you're not doing anything, you just dream that you're in the act, and before you know it, you push out something that can actually stain.
Okay.
We have to talk in coded words. It's a morning program.
You feel that spiritual.
So a lot of people can interpret it in a number of ways. People could say it has to do with marriage in the spiritual realm and what have you. Okay, but I think those are normal life events, physiological events that can occur in the lives of men. Okay, so other causes too that we need to point out, just for the benefit of people who may be joining us for the first time, is lifestyle modification. So some of the things that could cause erectile dysfunction include overweight, sedentary lifestyle, overweight, obesity, okay, that can cause that. Inactivity can cause that, okay. Smoking can cause that. Being an alcoholic can cause erectile dysfunction, okay. But there are two major causes of erectile dysfunction: the physical causes as well as the psychogenic or psychological causes. They are the two major causes, okay. But the physical causes appear to predominate, okay. But also, it will also be nice for us to point out that the psychological causes too could cause, sometimes it could become a major problems, okay. We said at the beginning, not today, that oftentimes erectile dysfunction may be a sign of an underlying illness that may not have been discovered in such a person. For instance, somebody who has cardiovascular issues, presenting with an erectile dysfunction could be a lead.
To such a person,
to such a person has a cardiovascular problem like hypertension, which the person may not know of. Okay, so psychological problems too. Stress can cause it. Anxiety disorder. There's also the one we refer to as performance anxiety. Okay, so as well as this can actually affect men along this line. Also, it's a bidirectional arrangement. I will explain what I mean by that. Okay, sometimes if a man discovers that he's having challenges with erectile dysfunction, okay, it kind of affects his image negatively. Okay.
Are you talking about the ego that goes with a man now?
Yes.
That's very
okay, so somehow we become moody, we
Yes.
become disoriented.
Less of a man.
Yes, we become stressed up, if you like. I think earlier in the week, I got a call from a woman who was complaining bitterly. She called me outside the program. She got my number from this program. So she called me outside the program. I think it was 2 days ago. And she was complaining bitterly that the husband has this challenge. And yet the man has refused to go and seek for treatment. Okay, so she was asking me, what other things could she do to enable this man go for treatment? He admits that he has it. He has these challenges, okay, but
Going
he
for
cannot come to
treatment.
terms with the fact that he needs to go for treatment. We cannot shy away from the fact that most of the time as men, we do not want to discuss our sexual habits. Even with our spouses or our partners, whichever one applies, we do not want to. So it's a topic that is usually shrouded in secrecy. Men don't come open to talk about it openly. And I can tell you this, that a problem shared is a problem solved. And oftentimes this will increase fear, and it becomes a bi-directional. The more you allow the thing to fester without seeking for solution, the depression increases, the anxiety increases. So instead of getting out of the situation, it becomes
Gets worse.
it becomes a cyclic
Vicious cycle.
yes, a vicious cycle that nails it. Okay, so it becomes a vicious cycle. But when you go for solution, of course, you need facts to conquer your fears. You need facts at all times.
Because you can't cure what you don't know.
Yes, it applies virtually in every facet of human life. You need facts, but this time around, medical facts. And that is why this program is for you. Okay, so if you're having some of these challenges, you can also listen to the previous editions that we have done, okay, so that you can do a catch-up. It's on YouTube, so you can always do that.
Okay,
So,
Dr. Matta, let me hold you a bit here so that you can actually sip your tea. While we go on this short break, because immediately we'll come, we must definitely
Open the lines.
so that
very
they can
much.
talk to you. Okay, we'll go on this break. We shall be right back. Go nowhere.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show where dey help people. Terms and conditions apply sha o.
For advert placement and sponsorship, make una call Stella Maris on top 070 3914 5229. Rebecca 070 6969 1950.
Yes, you're welcome back to Health Matter and erectile dysfunction. Now we dey talk about things we get to do with man. Well, it affect woman too, because as doctor TikTok, instead they receive calls from women say, as my husband no do well, it no make me happy. So make we no say I'm as a man's problem alone. Rather, it affects the home.
Seriously, when the man no dey satisfied, the woman must complain.
Most
Yeah.
definitely.
So as it affect the man, it affects the woman.
Affects the home entirely. So, Dr. Bat, can
Yeah,
we
so-
proceed to treatment now, sir?
yeah,
Okay,
so, but before we go
sorry,
to
doctor, the
treatment,
numbers.
Okay,
Okay.
phone line.
Okay, so guys, of course, Chief and I don't they get our own share of the old show since, but now it's time for you guys to call us, talk to us, and like waiting doctor been talk this morning, man, you guys need to open up. You understand? I understand, where confidentiality they come in, but your doctor is someone you should be able to trust. That's the deal. 08105434985, because 08173147589. Just kill the volume on your TV set, and we are good to go.
Yeah, thank you very much. Yeah. So erectile dysfunction has to do with recurrent or persistent inability for a man to achieve and sustain satisfactory erection that will lead to a satisfactory sexual intercourse. Okay, so we have enumerated some of the causes. Okay, so how is this problem diagnosed? Okay, how do we make a diagnosis of erectile dysfunction? Now, in making a diagnosis of erectile dysfunction, we have to look at the underlying
Causes?
we have to look at
Causes.
suspected underlying causes. Okay, and then we do our investigation along those lines. For instance, if you think the erectile dysfunction may have something to do with diabetes in an individual, you need to also order investigations to make a diagnosis of diabetes, and that will include doing some blood workup, blood tests like fasting blood sugar, random blood sugar if the person has eaten food at the time you're meeting the patient, urinalysis too. Okay, so if you do urinalysis and there's a presence of glucose in the urine, we'll call that glucosuria. So if an individual has glucose, if an individual is passing out glucose in urine, it's an indication that such an individual has diabetes. And of course, this can be a cause of erectile dysfunction. So if you discover the person is diabetic, you need to treat the underlying problem. But you need to start with a detailed medical history, which we refer to as clerking. So you need to interact with this patient, ask a number of questions. Okay? Now that will enable you to have an idea of what may be causing this person's erectile dysfunction. If you think the person has challenges with cholesterol, you can order for a fasting lipid profile, okay? And of course, if you have the result, you'll be able to put the person in the right treatment to lower the cholesterol. If you also think the person may have a cardiovascular disease, you may do a workup that are related along the line of cardiovascular challenges.
Like
in which
ECG?
case, yes, thank you very much. I think you've done it before.
Prince,
okay,
how
so-
you dey? Prince, how you dey?
Doctor, how are you?
I'm fine today. Good morning, sir. We can hear you, Prince.
Please, I called you. I wanted to call you last week. As you were about finishing, you probably giving your number.
Okay.
So today, I am privileged watching you.
Thank you, sir.
Please go on, sir.
Okay, mine is just as you said that what they call fast. Let's copy the number now. What they call fast release. You know what I mean?
Okay, quick ejaculation.
Yeah, please. What actually is the main cause?
Of quick ejaculation.
Yes.
Okay, thank you very much. Now, a number of causes, quick ejaculation, okay, or premature ejaculation, that's the medical name, is actually a big topic on its own. So hopefully along the line, one of these days we'll look at it. We'll dwell on it. Okay, so but let me say a thing or two about premature ejaculation. It's not as small as people think it is. It could be caused by a number of factors. Okay, sometimes things like prostatitis, okay, infection that affects the prostate, which are usually commoner in people who are below the age of 40. It can lead to that. Performance anxiety could also lead to that. Okay, but a number of things can actually cause it. It's just a big topic from what we usually view it as. That is like this is no. It's a whole lot that are involved in that topic. Premature ejaculation. Hopefully another day we'll be able to dwell richly on it so that we can enumerate the number, all the causes.
Okay, for the sake of Prince, let me quickly ask on quick ejaculation, sir. Does it have a treatment? Is it something that can be taken care of?
It's something that can be, thank you very much. It's something that can be taken care of. Okay, so anybody who has quick ejaculation, my advice would be for such a person to see a urologist. Okay, so if you see a urologist with complaints of quick ejaculation, they know what to do. Okay, so they need to do investigations, just like we are enumerating now, along that line to actually know whatever may be the cause, and as well as treat the cause. And when that is done, of course, the person will get better. Sometimes the treatment may involve psychotherapy, in which case it is not just a drug-related kind of treatment. The person may need to be talked to by a psychologist, by a sexual psychotherapist. Okay, so there are people along that line who could sit you down and then listen to you and then talk to you on things that can be done. So the treatment could be in two ways. Okay, it could be psychotherapy, and it could also have to do with medications and drugs. Okay, so back to the diagnosis. Okay, so we talked about taking a detailed history, and of course, next to that will be to do a general physical examination for such an individual, and then you examine the systems. Depending on what your findings are, that can also guide you in tailoring the investigations, the lab tests you want to send this an individual for. Okay, so some of the things that we can send such an individual, depending on what the findings are, is hormonal assay.
Okay.
Before now, a lot of people used to think that it is only females that can do hormonal assay. Males too can do hormonal assay. Okay, so derangement of hormones in the body can cause a number of challenges.
Maybe shortage of testosterone. At least I learned that
really,
one.
Yes, can cause a number of not just hormones that are related to reproduction and all whatnot, even some other hormones. Now, when we are talking about hormonal imbalance, we are looking at endocrine issues, endocrine-related problems. Okay, for instance, the hormone could either be higher than normal, or could be lower than normal.
Are we talking about adrenaline hormones here?
Yes, we are talking about all hormones. Okay, it could be when you have under-functioning thyroid, that could give rise to hormonal imbalance. Over-functioning or overactive thyroid.
So it has to be moderate.
Yes, that can give rise to hormonal imbalance. Pituitary glands, all the endocrine glands in the body, they produce one form of hormones or the other. And these hormones are just chemical components in the body that usually subserve some specific functions. So if you have them in an increased form, higher than what it should be, it causes a problem. If you have them in reduced form, lower than what it should be, it causes a problem. Again. So you could have hyperthyroidism, you could have hypothyroidism. Okay, so, and a number of others like that. So if you think such a person has challenges with hormone, you can send for hormonal assay. For a man, the one we'll be looking at for a man will be testosterone. Okay, so getting to correct that too can also solve the problem of erectile dysfunction if it has to do with that. Also, for such an you can also send such an individual for a number of imaging investigations. Top on the list will be to do a scrotal ultrasound. Sometimes the person may have varicocele. Okay, so what that means is challenges with the blood vessels, okay, that supply that region of the body. Okay, so if that is the problem, it could, of course, the person will look for solution. The doctors will try to correct whatever is the problem along that line. Now, once we are done with diagnosis, we'll start talking about treatment.
Okay.
Permit me to say that in talking about treatment, the treatment usually, from experience, the treatment...
Hello?
Yeah.
Oh, we have a caller. Good morning,
Sorry, we
sir.
didn't know.
Hello?
Hello, good morning.
Sanusi.
Huh?
Good morning.
Good morning.
All right, do you get question or contributions to make?
Yes, I get question to ask.
All right,
Yeah,
please go on.
ahead.
Yes, I have the problem on my under my stomach, on top of part of my bladder.
Okay.
So what I have is swelling on top of my bladder under my stomach. Whenever I breathe hard, it swell up. Sometimes it relax, and I have noise from there.
Okay, Mr. Sanusi, is it close to where you put your belt, sir?
Sir?
Is it close to where you put your belt? Is it along that region where you put your belt?
Yes.
Okay, thank you very much. I think you may be having challenges with what we refer to as hernia, inguinal hernia. Okay, so I think you need to see your doctor. Okay, usually when you cough or when you want to probably pass through and strain and increase the abdominal muscles, if you try to strain, the swelling pops up. When you're much relaxed, it goes back again. I think most likely a case of inguinal hernia. So I will advise you to see your doctor. Thank you very much, sir.
Sorry, sir. This inguinal hernia you talk about, is it the same thing that we call hernia on the street?
Yes.
Oh,
This spelling is Hernia. Okay, so it's not hernia.
I think
body.
that's the Nigerian way of calling it.
Hernia. I just want
That's
to
what we
make
call it, yeah.
Yes, it's hernia.
Okay, we go to treatment.
Okay, so the treatment of hernia is just like the name implies or sounds, herniorrhaphy. Okay, so yes, that's the treatment of hernia. Okay, so we've talked about urine test, blood test, physical examination, as well as imaging technique. Okay, so there's also psychological exam that needs to be done. Of course, that will be done by, if you think the problem has something to do with psychology. Okay, so that will be done by a psychotherapist. Okay, now talking about treatment proper, the number of options available. Okay, before the call came in, I said experience has shown that usually we'll get better results when couple are involved in the treatment of erectile dysfunction.
Okay.
Because sometimes, especially because it is an aspect of our lives as men that a lot of us will shy away from discussing. Sometimes too, we avoid discussing that with our partner, with our spouses, and of course, it increases tension in the home front. Okay, I can tell you that a woman may be having a wrong idea, may not know that you're even encountering challenges. We have Joy from Delta.
I think I will come back to that. Joy, good morning.
Good morning, sir.
Yeah, good morning, Joy.
Huh?
Go on with your question, Joy.
Okay, my question is, what is wrong with a man that, during intercourse he passes out blood?
Thank you very much, ma. When a man passes out blood during intercourse, it is abnormal. It's an abnormal situation. I must start from there. Okay, so such a person needs to be further evaluated by a doctor to actually find out what may be responsible. I also want to believe that such an individual may also be having pains, okay, during intercourse. He may also have pains during intercourse. He may also have pains even when he passes urine or burning sensation or discomfort. If all those other symptoms are also in the picture, we may be looking at an infective process here. Okay, so I think the person may have one form of infection or the other. So further evaluation will be required by a doctor so that such a person can get treated. Thank you very much.
Before the call from Joyce, sir, the thing where you talk about now, something we say a friend of mine has actually attested to, but I feel it's better we complement this. It's no joke. My friend talks, say whenever in the house with his wife, in they even feel they maybe get sexual problem. But if they go clubbing and every other thing, the way these girls play with him and everything, funny as it may be anyway, gives him that assurance that he doesn't have a sexual problem. So I don't know, could it be at times the kind of treatment we get from our usual regular woman? Can it be the cause why some people even feel they have a sexual issue? Because at times when you venture outside, which I'm not an advocate of anyway, but I feel I don't know, changing of partners, can it actually be a panacea?
No. Of course, just like you said, nobody will advocate for that. But I must also point out that in the world, we do know that we have monogamous family setting. By the same token, we also have polygamous family setting. Okay, so sometimes, like the urologist that came the other day, he tried to shed more light because I think we got such
Dr.
a question.
Alabi?
Yes, Dr. Alabi, Wemi Alabi. Okay, so sometimes the sexual fantasies that one gets exposed to, usually when you watch porno and some other things, may not be what is obtainable in your home front. Okay, so if you keep dwelling on such things, it could have a negative effect on your sex life. By the same token, the fantasies that you may come across as a man when you get into such environments too may not be what may be obtainable
at home.
in the home front. So there's a number of ways that we can look at it. The psychological aspect, as well as, of course, the psychological will eventually affect the physical because they are related, or it could be a mix of both. Okay, so we need to be careful with what we indulge in because some of this will have a way of coming back to haunt us.
Yeah.
But
okay,
like you said, sir, doctor, does that not tell our wives to actually brace up, or because you are about going that line too? They are braising up.
Is
Don't
it
you think it
braising up
helps?
or you over expecting? Because
it's not.
no, seriously, like what doctor
She's
said.
speaking for the women
No,
now.
yes, I'm speaking for the women. Like what doctor said that he mentioned watching porno and all of that. Now, when you watch all of those things, it is just normal for you to come home and expect your wife to behave like one of those girls, forgetting the fact that most times they do that under an influence.
No,
Do you understand? No.
What I also want to add to what you have just said now, men should also. I'm coming. We as men, we as men should share part of the blame. Okay, because
Okay,
sometimes
let's take Destiny first.
from Taraba.
Hello, Destiny. Good morning.
Destiny, good morning. How you dey?
Where is sounding?
Destiny, where is the destination?
Abi, it's calling from Taraba, but I
we lost
think
that. I don't want
Okay,
to. I don't want that fire from
yes, hopefully you call us back.
Yes.
Okay, so sometimes what you want your wife to look like or your spouse to look like as a man, you need to make her look
Bam.
bad.
Doctor, God bless you.
Okay, so when we starve them of funds, when they don't have the financial wherewithal to attend the looks we want them to look, you may not have dropped enough for her and you want her to do this
look
and
sexy
do that.
and all.
It doesn't work that
At
way.
all.
I think where you are right is my own personal experience now.
So we also need to, whatever you want your spouse to look, you should make sure that you equip her with the
Well,
necessary things.
I think you are right. Because to support you on that, you didn't believe my wife walked
That
up
way
to
she
me.
At all that
That is to look.
No,
it's that's
easy. My wife walked up to me last week, doctor, and she told me, dear, I just want us to go and have fun. Let's go and dance. Let's go. In my mind, I was like, which movie is this woman watching of late? And I was like, you know the defense of a man, the children come. Well, we will take care of this. I said, no, I've made arrangement. Next time we come, I just want us to go and dance.
Yes.
And,
Once in a
that's
while.
why you go.
yeah, you want to go and dance in
Yes.
club in the night.
Okay, so
That's good.
oral medications. Okay, so some of the oral medications that are used in the treatment of this condition. But before, let's take it. I want us to take it
One step and another.
one step after another. Okay, there are medications that could help in solving these problems. Okay, apart from medications, there are also some devices too that could be useful.
We call them machines now.
Vacuum devices. Machine may not be the appropriate word. Okay, so like vacuum devices too can be used. Okay, so apart from this, okay, so we have one being shown on our screen now.
Wow.
Okay,
What
so,
is this?
we'll talk more about that.
Okay.
Now, apart from this vacuum, there could also be injections that could help. Okay, there could also be surgical intervention, but usually it comes as a last resort. Okay, so but let's start with drug treatment. Now, the drugs that are usually used in the treatment of this condition, I'm sure every grown-up man will have an idea when we mention some of these drugs. But like we said, we'll avoid as much as possible in order not to mention the brand names. Okay, but you have drugs that are usually called oral phosphodiesteride type 5 inhibitors. Under them, you have drugs like sildenafil, is about the most popular one. You have tadalafil, and you have vardenafil, as well as avanafil. Now, these 4 drugs, for instance, they are not drugs that on their own can bring about erection. Okay, when you take such drugs, you still need sexual stimulation. Okay, and the timing usually for these drugs will hover between 10 to 15 minutes to 36 hours prior to getting into the act. Okay, so a lot of people, 80% of people with these challenges have benefited immensely from this type of drugs. But usually there is
an effect, a side effect?
Yes. There are side effects, but there's also some warnings that usually will come with them. Okay. For instance, before you commence any of these medications, you must ensure that you have discussed them over with your doctors, because sometimes they could affect prescription drugs that such an individuals are taking. For instance, someone who has angina, problem with angina pectoris. Angina has to do with some painful conditions that affect the heart. Usually we'll put them on drugs that are called nitrates. People who are on drugs like that, okay, need to be guided, because if they take drugs like this, that can further drop their blood pressure. Okay, so your doctor needs to know that you're on such drugs, and also they are not drugs that you can take more than once per day. So a number of people who have this problem have gotten good results with some of these drugs. Okay, now apart from these drugs that can be taken, we also have our prostadil injection. Okay, now our prostadil can come in an injection form or pellets that can be inserted into the penis to bring about erection. Also, what we saw a while ago, the picture was that of a vacuum pump. How is it used? People who drugs may not have benefited can actually resort to this. It can be powered manually, it can be pumped manually, and it can also be powered with electricity, okay, battery powered or with hand. There's also implants, penile implants too, that can help, but this will require a surgical intervention. There are two types of penile implants here. One is the one that is bendable, the malleable one. Okay, our time is up.
Okay, but doctor, please, I want us to pick up from here
right?
next week.
Better.
Viewers, we hope you really enjoyed the show because we did, yeah. Myself plus Slimy and doctor from us, we're going to say thank you. Goodbye.
Yeah.